Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Herkel, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Happy Thursday, everybody. We can go to our first question with.
Yeah, thanks a lot. All the way from Amsterdam. So, I'm not a native speaker, but I'll do my best. So my question, a short introduction, is that I've had a concussion almost 2 years ago. And since then, I've been recovering, but I've had a lot of bad luck with new blows to the head, like a door hit my head, or I got a ball to the head. So, and every time I had a major setback, and I thought that each one was a new concussion. But upon starting the program, the course, I realized that for a concussion, there has to be like a really big impact. So my question is, why do I still get this increase in symptoms every time I hit my head or I bump my head? And should I just follow the program, or should I focus on other stuff? Because I don't know. That's the question.
Yeah, so Nikki's just put it into the chat here, but have you seen the concussion cliff video?
No, I haven't yet.
Yeah, so that will explain everything. I'll kind of give you a quick synopsis of it. So persistent concussion symptoms are not due to brain injury, right? They're due to other factors. If you've had persistent symptoms, essentially you can think about it this way, is that concussion is just a stressor on your system. So it'll put stress on your autonomic nervous system, it'll put stress on your gut, it'll put stress on your hormones, it'll put stress on your mental health, it'll put stress on your neck, it'll put stress on your visual and vestibular systems. And essentially it's like, if you are thinking about, like, let's say there's a cliff, right? And if you're young and healthy and you're standing way back here, if you have that stressor put on you, right? You get a concussion, boom, it's just going to push you a little bit. But because your systems are in good working order, you don't result with persistent symptoms. You kind of recover and you go back to kind of where you were. But if you have underlying anxiety, for example, that pushes you closer to the edge. If you have a little bit of autonomic issues going on, that pushes you closer to the edge. If you've had previous neck issues, it pushes you closer to the edge. So basically, if you're standing here and you get your concussion, well, now you fall off the cliff, and now that's where people get persistent symptoms, right? So you're doing all the things to fix your systems, and you start feeling good, but essentially you're basically just right back up to the very edge of the cliff. So you're like, I'm feeling good, but then all of a sudden you get a little bit of a bump on the head, or maybe you return to work too quickly, or maybe you have some emotional stress, or you get in a fight with a friend or a loved one, and now it's like you have this initial stress, or maybe you have a couple bad nights of sleep. All it's doing is just dysregulating your system again, and you fall off the cliff. So if you have, let's say, anxiety around hitting your head again, where it really worries you, Well, when that happens, you're going to be like, oh God, have I done it again? And you're going to start really looking for symptoms. And that's going to cause you to be a little bit more on the sympathetic dysregulation side. And boom, you fall off the cliff and all your symptoms come back again. So it's not another concussion. It's just a stressor on your system. So the goal here is the stuff in the program is designed to fix those systems. So as you fix those systems and you start feeling good, a lot of people make the mistake of being like, "Oh, I'm feeling good. I can stop everything I was doing now and I'm just going to leave the program because I'm done." But what they don't know is they're actually standing right here. And the next little thing that comes along, they're just going to fall off the cliff again. So what you want to do is you not only want to get up here and get yourself feeling good, but you want to keep doing all the things that got you here so that you can get yourself well away from the edge of the cliff so that next time you bump your head, it's just one of these, right? And you don't kind of spin out of control and start to get worried about it. It's not the initial insult, it's kind of like how you respond to it. But also, let's say you had neck dysfunction. It takes a small amount of force to actually, cause further dysregulation of your neck if you already have it. So it's continuing to strengthen, continuing to work on the things, then you know what I mean? So it's just a sign that you're not fully recovered yet. That's all.
Yeah. All right. Thanks a lot.
Okay. Now, if you
Yeah.
watch that video, I go into like more depth on that, but I wanted to give you kind of that quick overview just for right now. But Nikki put it in there. I put it on YouTube. You can check it out. So essentially what you want to do is, yeah, you just want to do the things in the program to try and keep fixing the systems. And when you do have a small impact or a stressor that comes along, this is where Melinda's stuff in being able to like calm the nervous system down. So let's say you get hit, you don't start spiraling. You have tools where you're like, okay, it wasn't enough force. It can't damage my brain, right? Now, and if you can calm things down a bit, you can prevent that spiral that, may cause a 2-month setback. You can maybe have like a few days of increased symptoms, but you're able to handle it because you have the tools in place to be able to calm the nervous system, right? And a lot of people will skip that section. A lot of people will come in and be like, anxiety, that's not me. I don't have to do that. I'm not going to do all that work. But if you don't do that work, at some point, something is going to increase your stress levels. And if you don't have good tools in place and you haven't done the work to put those tools in place, you're not going to be able to call upon them when you really need them. So it's really important to work on that. And that's one of the most important things of this is because when something happens, if you can call upon those tools, you basically prevent a major setback because you're able to calm yourself, hit your stabilization point, and then just keep going.
All right. Thanks a lot. Yeah, that's very helpful.
You're welcome.
Thank you for calling on me. Sorry, I had to unmute myself. A little bit of background about me is I've had post-concussion syndrome for the last 6 years, and I didn't find out about the concussion fix until just recently. But I've kind of just been continuing on with my life as normal, just kind of dealing with it, just kind of living in my little bubble. I finished college and then started my job. But then back in January, 5 months ago, I had a really bad setback, and then all the symptoms kind of just flared up again. And so when I came across first I came across some of the free stuff on YouTube before I signed up for the course, and I saw that what we had to do as part of the recovery was to expose ourselves to the symptoms kind of gradual, or the things that would cause the symptoms kind of gradually, but don't overdo it all at once. But I've just been continuing to work full time in the meantime. I'm a software engineer, so I'm on a screen 8 hours a day, and I feel like there's like points where I do pretty much overdo it just about every single day. And I was just wondering if, for the duration of the course, if this is something where should I see if I could just get an extended period of time off for work just to be able to commit to the course 100%, or do you think this is something that I'll be able to do the concussion fix while still being able to work full time just because of, you know, having all like the expenses and stuff that I have to take care of day to day, that I was just wondering about?
I mean, these are always difficult questions because in one sense, if you were to take time off, let's say, in some cases that can be helpful because it allows you to focus on the recovery side of things and not have this additional stressor that's just kind of keeping you stuck potentially, where you're just hitting a wall every day and it's just not allowing you to kind of build, because you hit that wall, you kind of fall back, you hit that wall, and then if you keep going like that and you keep running, yourself at 100%, eventually you crash and then you end up with a big setback. So that's one side of it. Now, the other problem with just taking time off is that it makes it harder to go back, because what you do is a skill. And with the experience that you have as you learn new skills and you become proficient in them, you get better and better, right? If you think about like a sport, right? Like if I wanted to, my kids right now are getting into hockey. Well, like when you first take them out, they can hardly stand up on skates. And then the more they do it, the better they get at it. And then when the summer happens and they're not on skates all summer and then they go back in the fall, they're rusty, right? You kind of lose some of it. Now, we know that that's just because they haven't done it for 2 months. But when you have a concussion and you take a few months off and you try to go back to it, your brain's not working at the same level and you start to think, oh, I still have something wrong with me. And you misattribute the time off to something's wrong. Do you know what I mean? Like when you get out of something for a while, getting back into it, even like reading, like if I don't read for a while and then all of a sudden I try to pick up a book, I'm like, oh my God, I'm a terrible reader. I can hardly get through a page in like 20 minutes. But it's just one of those things that it's a skill. And the more you keep kind of at it, the more you keep that skill. So I don't like the idea of just taking time off, especially if you're already working and you're working full time and you're kind of getting by. What I would rather kind of shoot for in your scenario is, what's a reasonable amount of time that you can do work before your symptoms start to really increase, right? If you're to sit down and start, running some code and doing some stuff, how long can you do that before you're like, oh my God, I'm just.
Yeah, usually it's for like about an hour at a time. I have some tolerance, but I can't just sit down and do it for all 8 hours a day straight like some of my coworkers can. It's not like only a couple minutes and I'm tapped out, but it's not for a super long period of time either. So my boss has accommodated me to some extent. Yeah, he it started off as just working remote a couple days of the week, and now it's just working remote all 5 days of the week. But um, I think too, because going back to one of the early modules in the course with the getting your mindset right, I think that was been one of the biggest stumbling blocks for me. I think because of the question that I asked, I was weighing that so heavily. Do I need to just shut it down and just like take time to just commit to the course, or do I do this while I'm still working? I think that was a big stressor for me too. So thanks for answering that for me, because I think just that and some of the other just like hidden stressors with all the what ifs, that is this going to affect work long term
Right.
any more than it already has, was something that was kind of adding to that stress, which in turn is just preventing me from kind of starting to build the foundation that I need in order to recover.
Right. Now, it sounds like you have a pretty accommodating boss.
Yep.
Is that the case?
Yes.
Yes. So what I would maybe see if you could work out would be like normally when somebody goes back to work, if they have been off for a while, usually what we'll do is we'll start them off Monday, Wednesday, Friday. And we'll start them off with just 2 hours per day on each of those days. So you always kind of get Tuesday, Thursday plus weekends off, right? And then what you do is every 2 weeks you just add 1 hour to Monday, Wednesday, Friday. So it allows you
Uh-huh.
to gradually build up, but you always keep Tuesday, Thursday open. And then you get to a point where eventually, after a number of weeks, you're at 8 hours a day, Monday, Wednesday, Friday, but you're always getting your Tuesday, Thursday off. Then you start adding a couple hours every 2 weeks to Tuesday and Thursday. So you get most of the day off, but you're still just doing a couple hours that day. And you're just gradually building your tolerance over time. So what you may want to consider, if you have somebody who's accommodating with you, is to say, okay, 8 hours seems like too much. You can do 1 hour stints at a time, but can you take an hour break between, right? Can you do an hour, and then go for a walk for an hour and just kind of chill, and then do another hour and then go for a walk. And then maybe you do 4 hours per day, Monday, Wednesday, Friday. Keep your Tuesday, Thursdays clear. And maybe you start with that. And then every 2 weeks, you just add, an hour or two to the Monday, Wednesday, Friday, until you can get to a point where you're able to do 8 hours a day, Monday, Wednesday, Friday, and your Tuesdays and Thursdays are clear. And then gradually build up on the Tuesday, Thursdays. And that just gives you enough time to keep your skills, because you're able to continue to work and you're not just taking the whole thing off, because then that, I think, creates more problems in many cases. But it also allows you to gradually build more tolerance as you go through this program, and kind of build more of the skills and work on autonomics and work on all those other things. Because a lot of screen tolerance issues are actually related to autonomics. They could be related to neck. They could be related to even just, anxiety and stress about that, because that's going to dysregulate the autonomics even further. And our autonomic nervous system is what controls how much light enters our retina or our pupils. And so, I don't know. That's kind of what I'm thinking in your case is could you do almost a modified protocol, but not go back to square one where you're starting with just 2 hours each day, but what's reasonable? Could you do 5 hours Monday, Wednesday, Friday? Could you do 8 hours Monday, Wednesday, Friday, and just keep Tuesday, Thursday off? Just say, look, I just want to drop 2 days a week. I'm going to gradually build those days up. But here's the kind of proposed schedule that I'm thinking. And could you talk to your boss about that, so that in the next 3 months, I'm back full time, but I'm better. I'm actually back and fully back, versus yeah, I'm here, I'm doing 8 hours, but it's a struggle. And I'm probably not being as proficient for you as my employer as I could be if I was operating on all cylinders.
Yes, sir. I will bring that up with him. Thank you very much.
No, just let's kind of talk through this. What do you think is a reasonable amount of time for you to do Monday, Wednesday, Friday? Do you think 5 hours? Don't be at your limit. Think okay.
Maybe 6 hours even, because I work from 7 to 4, and usually around 2 o'clock each day is finally when I kind of just run out of gas, when I hit the wall, when I'm just not feeling good, and I just have to survive until the end of the day. So I guess that could be the first kind of stopping point.
Yeah, I mean, I don't want to get to the point where you're I'm completely out of gas. I want you to stop just before that point.
Yeah, so in that case, 5 hours might be good, like you said.
Let's say 5 hours. All right, 5 hours Monday, Wednesday, Friday, and for that you're going to do that for 2 weeks. Because then on the Tuesday, Thursday, you get to recharge, and then on the days you're working, you're not hitting your wall, right? Because it with this type of stuff, whether it's cognitive or physical activity, you have a threshold, and you want to work below that threshold. So if your threshold, basically what you're telling me is 6 hours is kind of your threshold. If you hit your threshold every day, then you're just banging against a wall, and eventually you crash because your body just can't take it anymore. So you want to go below that threshold. This allows you to keep the skills and build up, and then every 2 weeks, just add another hour to the Monday, Wednesday, Friday. So if you can propose that schedule, hopefully they're willing to work with you on it. Monday, Wednesday, Friday, I'm going to do 5 hours per day for the next 2 weeks. After 2 weeks, I'm going to add an hour to Monday, Wednesday, Friday, so I'm up to 6 hours. After 2 weeks of that, I'm going to add an hour to now I'm up to 7 hours Monday, Wednesday, Friday. And then after 2 weeks after that, I'm going to go to 8 hours on those days. And then after that, I'm going to add 1 or 2 hours to my Tuesday, Thursdays, and then just every 2 weeks, add another hour to those until you're at 8 hours.
Yes, sir.
Okay? Because then that's
Thank you so much.
That's a manageable thing. You can also use the additional time to just kind of, relax, let your brain restore or let your body restore, I should say, and then work on some of the other strategies within this program, which are going to gradually build more tolerance for you. And then I think that'll be a good process.
All right. Thank you very much. I appreciate it.
You're welcome. Okay, next up.
Hello.
Hello.
I'm kind of talking for my wife. She has a pretty bad concussion. I think we've reached out a couple of times where it just seems like no matter what, she's regressing more than moving forward with anything. Light sensitivity, what she's able to handle. Now, there are some things that are better. She can have conversations a little bit more, but it just seems like she keeps hitting a plateau very quickly and is even unable to know when her symptoms spike. It kind of goes from 0 to 10 really fast. Trying to know, what to do, what steps it takes, what not to do is kind of the question. And hold on, here she is.
I'm sorry, I'm already at my threshold right now, but I've been wanting to talk to you for a while. Because I keep regressing, and I think what you were just saying about crashing, I think that's what's been going on. But this concussion started out pretty mild, and I am at a point 10 weeks in where I can't function. I can't even open my eyes in my house anymore because I'm in so much pain from muscle. I keep getting muscle strains, and they keep straining and straining, and it's regressing me into the dark more and more, and I can't seem to get out of it. My anxiety has shot through the roof. I can't sleep. I go days with no sleep now. It's like I've heard you say before about spiraling, but I had started therapy a few weeks back, and started to do a little bit better with it. But I hit this eye strain. I also had my back. I have spiral with sacroiliitis. And I have autoimmune issues too, like a hypersensitive immune system that makes it very difficult for doctors to treat me with medicine. So I have to do a lot of this with no pain medicine or really any help with much. And I'm at a point where it's very hard because I'm not living and I feel like I'm just getting worse. And it's been so long and I feel like I'm in a hole that I can't get out of right now.
What are your kind of main symptoms? You said you started therapy. What kind of therapy?
I started me and eye therapy. And eventually, once I can read up to 5 minutes, they'll start me on cognitive.
Yeah, no, I disagree with all of that. I don't think you're ready for that yet. Like those things you need to have like a solid foundation, right? Like you sound like you're very dysregulated, and that just adds an additional stressor to your body, right? The whole thing, like cognitive, for example, cognitive issues in people with persistent symptoms are mostly related to anxiety and depression. So trying to go to cognitive therapy to fix a cognitive problem is actually not the right thing to do. You actually want to work on the anxiety and depression because your cognitive function will improve naturally once you're able to fix those things.
Is that meaning when you say cognitive, do you mean like having the ability, like whenever I try to think, my brain, it saps me of all my, and I'm at 10 right away. Or if I try to have a conversation, my brain saps down and I can't talk and finish a conversation.
Yes, that's mostly related to anxiety and depression.
Okay.
Yeah, because if you think about like what anxiety is, it's like your mind is just going a million miles a minute, right? That's going to burn a lot of energy. And then when you're trying to focus on cognitive tasks, your mind is still spinning in the background and you're not able to focus on what you're focusing on. So the conversation, you're missing parts of the conversation. And then your mind goes to, oh my God, I can't pay attention anymore. There's something really wrong with me. And then that's the spinning thought that's going on in your mind. And that's just burning a lot of energy, right? There's this concept that has been well studied in concussion called default mode interference. And so if you think about your brain, you have kind of two main brain networks. One is your executive network, which is when you're focused and dialed in. This is what they call the flow state. When you're kind of just doing things and you're just in the zone, you're not thinking about anything else. You're in the flow state zone. That's your executive network. Then you have a network called your default mode, which is your kind of internal dialogue, right? It's the little voice inside your head that, you're daydreaming about random things. Oh, I got to do that. I got to do this. I got to pick this up later and whatever. You're just going from thought to thought to thought to thought. That's default mode. Okay. Now, normally when the executive network turns on and you're focused on a task, the default mode turns off. And vice versa, when you're not focused on a task, the default mode kicks in and you're thinking about random things and whatever else. What happens in concussion patients, and we've studied this with fMRI, is that both networks activate simultaneously. So what happens is you perform poorly on the task because your little default mode keeps chiming in with random thoughts about random things, and here you are spinning in kind of a rumination cycle and you're not able to focus on this. Now what happens there is because you're using two brain networks, you burn twice as much energy. So you're unable to sustain yourself in that cognitive task for very long because you have both things going on. All right?
Makes sense.
Now, what we also see is that happens in people with anxiety disorders, people with PTSD and chronic stress. We see that in all sorts of other kind of, mental health more conditions. And what we see is that people in experienced meditators are able to shut that off. They're able to shut off that default mode and go right into executive network very quickly. And we see the same thing with things like psychedelics and psilocybin and things like that, which is why those are being studied heavily for, anxiety, because you're able to like completely eliminate the default mode and go right into like executive network. I see Melinda's unmuted herself, so I know she wants to chime in here. She's probably chomping at the bit. But I think that what you're experiencing right now is that like you're so dysregulated and that just living is like too painful and too hard for you right now, right? And so adding an additional piece like trying to do vision therapy is going to crush you. And trying to do cognitive therapy when I don't really even believe in cognitive therapy as a starting point. I think we should fix the underlying systems first, because cognitive function is related to stress, anxiety. It's related to pain. If you're in pain, it's hard to focus. You're not going to be able to think straight. If you're dizzy, if you have other symptoms, you're not going to be able to think straight. So it's doing the work to get rid of all the other symptoms. And generally what happens is cognitive function just returns to normal. So trying to fix cognitive function before you've addressed everything else is just a waste of your time and a waste of your energy. Focus on addressing the underlying systems to try and calm things down so that you can kind of start, living again. Because what happens is if you're very light sensitive and you have a lot of pain and your solution is to just lie in bed and remove yourself from life, you will continue to get worse and worse and worse and worse. That's just how it goes, because your threshold for what you can tolerate becomes lower, right? Like if you were to wear earplugs and sunglasses inside, that doesn't help you. It actually makes you worse over time because you become more sensitive to sound, you become more sensitive to light because your body adapts to the stresses you put on it. And if you start putting no stress on your body, then any stress is now stressful. So you have to start building up. You have to kind of say, I'm going to start doing things. I'm going to take the sunglasses off. I'm going to start exposing myself to regular light and regular stimulus and not hide. Because those things are not bad. They are not harmful. Yes, they can increase symptoms, but that is not harmful to you. So it's being able to separate harm from hurt kind of thing, I'm going to pass it to Melinda because this is kind of more like her area, but I wanted to give you that default mode idea and the idea that we need to kind of change things up and stop hiding from life, because it's just going to continue to spiral down. You have to kind of make a change, and we can help you with that change, but I want to know where you're at after. But let's see what Melinda has to say, and then we can pick up.
Can I ask, or just one thought before we switch, if we can, before we switch off? I know the one main thing that hurts her is she has a lot of eye pain. So when she goes and does anything, the eye pain gets very strong and it is debilitating. how do we make progress with that pain? I think that's really the biggest question.
Yeah. Have you guys actually started going through the modules and stuff?
Yes.
Okay. So a lot of eye pain, like it could be related to ocular issues, but it's not like a vision therapy thing. And I wouldn't do vision therapy. Remember, rehab is the very last step.
Yep.
It's after all the other stuff. But a lot of eye pain is also related to neck issues, right? I was recently at a conference in Iceland and I spoke on neck function. And one of the stories that I told there, I'm going to repeat here. But when I was doing my sports medicine fellowship, I shadowed at like a chronic pain clinic. So they deal in people that have had like really chronic pain conditions for years and years and years. And it's one of these things where it's like the last stop on the road, right? You've been to neurology, you've been to neurosurgery, you've been to all these people. No one can figure out what's wrong with you. Then they send you to chronic pain. So this woman came in. She had a 10-year history of eye pain, very bad eye pain. And she had been to neurology and neurosurgery and all those things. She'd had imaging done. They thought maybe that she'd had a tumor in her eye because she had this eye pain, but all the imaging was normal and nothing was there. And so anyway, they basically diagnosed her at the chronic pain clinic with like psychogenic pain. It was they attributed it to like childhood trauma and all of these things, thinking that had caused this, this pain. And I'm sitting there because I know referral patterns. And I was like, somebody's got to touch this girl's neck because I think it's probably coming from her neck. And nobody did. So finally I spoke up and I said, can I poke at your neck here for a second? And so she let me do it. I pushed on one side. I said, I just want you to tell me where you feel that. And I pushed right here in her suboccipitals. And she said, I just feel it where you're pushing. I said, okay, good. I go to the other side and I push there and she just goes, oh my God. And because the referral for the eye is from the back of the neck. And so a lot of times eye pain, people think that something wrong with their eye because that's where you feel the pain. But there's this concept called referred pain, where pain in other parts of your body is felt elsewhere. So for example, heart attack, right? If you have a heart attack, where do you feel the pain?
Down your left arm.
Down your left arm. Is there anything wrong with your left arm?
Nope.
No. It's just it's how your brain perceives pain. Your brain just goes, something's going on over here and I don't know where it is, but it's something, right? And it's the same thing. Your head and neck come from the same kind of area of like the fetal development. Head and neck come from the same area. So the wires are all crossed. And so people that feel pain in the face is often related to the SCM muscle. People that feel pain in the eye can be SCM, but it also is suboccipitals. People that feel pain on the top of the head comes from a muscle called the splenius capitis. And so all areas of your head can be mapped to muscles in your neck that cause the pain to be felt here, right? Or here. You're feeling it here, but it's not a problem here. It's a problem back here. I'm not saying this is 100% because you can have eye issues that can cause that, but presumably you've been checked by an optometrist or something that's taken a look at the eye itself.
Yes.
Yes. Oh, and everything's fine?
Everything's fine. Yeah.
There you go. So to me, this is probably a neck dysfunction issue. And if you have somebody who can do a little bit of, massage or a technique I really like is called active release therapy. If you go to activerelease.com, you can find a provider and go in and do it. Now, the problem is that oftentimes if you're in a very dysregulated state, like it sounds like you are, manual therapy can be triggering. It can actually flare things up because your body is in a sense of fight or flight. And anyone pushing on things and touching things and causing increased pain can make your body go, and make your overall dysregulation worse. So it's this delicate balance. And that's why we put rehab at the end. But in some cases like yours, when you're just in extreme pain, a little bit of work might help that just to be able to get you out of this funk and being able to do a little bit more. So in your case, I would almost recommend that you give it a shot because you need something to just break this cycle that you're stuck in, because as your world is getting smaller and smaller, it becomes harder and harder to make a step forward, right?
Yes. Yeah, that's definitely the case. Thank you.
Yeah. So let me throw it to Melinda, and then I want to dig in on this because I feel that, I want to try and give you something we can start you with to try and get you out of this funk.
Mm-hmm.
Okay.
Thank you.
Well,
Let's go.
I think you've got the plan kind of laid out. Like I also feel like if you're in too much pain, you're not going to be able to do the practices that are going to support that default mode network, right? In the language that I use in the recovery mindset module, we talk a lot about this window of tolerance, right? So when we're dysregulated, we're outside of our window of tolerance. We're not able to do anything productive when we're outside of our window of tolerance. We're too dysregulated, as Dr. Cam was saying with the default mode network example. And if we're in high pain, that's also going to bump us out of our window of tolerance and make us more dysregulated. So I agree. I think getting some neck work done is going to be really important right off the bat, alongside doing really grounding and regulation practices that are going to support your nervous system. So our nervous system, in essence, just freaks out when we're in high pain and following an injury. It's not just anxiety and depression, it's a combination of everything. If our nervous system is dysregulated, it's going to generate more anxiety, more depression. This all happens when we're outside this window of tolerance. So we're not able to, if I'm using your analogy, Cam, this default mode network is too high. How do we say that? For the default mode network.
It's just not turning off.
Not turning off. Okay.
Yeah,
so
they call it default mode interference. It's interfering with your executive function.
Yeah. So when we're in states of dysregulation, we want to bring safety back into the body. If we bring safety back into the body, we want to do that with really gentle movements like grounding, stabilization, some gentle somatics, gentle mindfulness. You can find all of this under the mindfulness section in the course right now. And then in our relaunch, there's a module called nervous system regulation. You can go right there because we're in the midst of re-recording the program right now. So I would recommend definitely getting some neck work done and having conversations with your provider about the intensity of the pain you're in, so that they can modify, right? Starting really gradually and slow, saying, this could flare you up, but we're working to really build or work through some of the challenges you're having neck-wise. And additionally, alongside that, you'll want to be doing some grounding work. And what grounding work does is it just reminds our nervous system that we're safe. We come back into our window of tolerance. We're more able to cope with the stress that we're facing, right? Sometimes when we're in high pain, we've had a concussion. What's going on is we're just constantly dysregulated. We're constantly outside of our window. We're not really able to do anything. And it sounds like that's where you are right now. And that can be a really distressing place to be. So the first line is bringing safety back into the body, working on grounding. So you can even jump right now, when someone in your position, typically we recommend listening to everything. But if you can't even listen and be able to tune in and learn some of the things we're talking about, you can jump to the first part of the mindfulness section and just listen to the nervous system regulation lesson to give you a sense of how to work with the window of tolerance. So listen to that module, understand how to bring yourself back down when you are dysregulated, alongside doing some really basic neck work. The two of those, I think, is a starting place, and then come back and see us. I wouldn't really recommend anything else. I think, anything else is just going to be too much at this point.
Okay.
Yeah. And so I just want to kind of figure out, can you give me an idea of what your day looks like right now?
Yeah, her day, and she comes in and out of the room as she can tolerate. Her day pretty much is a couple minutes of trying to tolerate something, and then goes back into kind of a darkened room, and then she might come back out with sunglasses on. The whole house is kind of shaded.
And I was doing more than this a few weeks ago, which is what's so disheartening. I can't even go outside anymore. I was trying to get out and get walks in the morning. Like maybe I couldn't get past 10 minutes, but my day before this happened with the eye strain, I worked myself up to be able to make myself oatmeal. For a while, I couldn't do anything. Everybody was doing everything for me. And I couldn't even tolerate being with my family. And I was in and out of my room. So right now with what's happened with the eye strain, I can't even open my eyes really much anymore. It takes days for it to get better that I can open it in the darkened parts of the house. So I'm not doing anything, and I'll wind up, because I'm going crazy, not being able to read, listen to anything. I can't even listen to your modules. I just pace trying to get walking in my house. But even right now, it's like too much for my eyes. So I don't even know what to do now. Like, I feel like I'm sucked into
Yeah.
this hole.
Oh gosh, right. It can be such a difficult place when you're, just feeling this escalation of everything. And often what that tells us is that your nervous system is becoming more and more dysregulated. It's not necessarily the pain that you're experiencing, which I understand is very severe. And that's kind of the thing we want to make sure we're working on. But when you're experiencing severe pain and then our nervous system gets dysregulated, everything escalates. Right? So now I'm hearing there's sound sensitivity, right? When it's just
Oh
sight,
yeah.
that tells us that our nervous system is just on overdrive. So I would really just recommend focus on grounding. Go right to the mindfulness module, listen to the blurb on nervous system regulation, work
Hmm.
through the short exercises that help you bring down the nervous system so it
Hmm.
feels safe again. What happens typically when people really practice just grounding is a lot of the added symptoms start to ease off. You're starting to feel a little bit more regulated. Then you can focus on the source of the issue, which is the eye pain, right? But if we're, you know, in essence freaking out, which makes sense to freak out, right? It is so painful. It's minimizing everything. It's a snowball effect. Everything starts to become overwhelming. Now we're adding other layers of symptoms that are being flared because of the dysregulation and the anxiety or other types of mental health challenges that are so normal to come up when you're extremely distressed. So the first thing before anything else is seeing if you can bring down that added layer, right? That added layer of symptoms that are really dysregulating for you. Then you can focus on the eye, right? So it makes sense that everything's just going to keep snowballing, right? You isolate, isolate, isolate because everything starts to become too much. We want to just focus on grounding. So something so simple as box breathing, right? We deep breathe in for 4 counts. We hold our breath for 4 counts. We breathe out for 4 counts. We hold our breath for 4 counts. Then breathe normally for a few minutes and do it again. What that does is it signals the brain to activate our parasympathetic nervous system, and we are forced to calm down, right? Our nervous system then goes into safety and we can start to regroup, right? This is going to take time. So box breathing is a really important one because it really signals safety to the body. Usually it's 5 to 7 breaths, but if we're really dysregulated, you want your 5 to 7 seconds to hold. But what we want when we're really dysregulated is shorter, right? Because we're probably not able to hold that long. So breathing in for 4, holding your breath for 4, breathing out for 4, holding your breath for 4. What I recommend for individuals who are experiencing a lot of symptoms is draw the box as you're breathing. Okay, so breathe in, count to 4, hold, count to 4, breathe out, count to 4, hold, count to 4. Okay, this is a strategy that's used by military in combat in order to stay regulated so that they can show up for unanticipated things. So it's really important as a number one to be able to regulate, and I honestly wouldn't do anything else. I don't think anything else will be digestible at this point.
Okay, thank you. I know everyone's kind of recommending medicines as well to try and help with pain or do this other to keep being able to push forward. It sounds more like grounding is going to be the best thing, and maybe that active release from the neck versus pain medicines, because she has a lot of allergies to things, and medicines are one of them that usually flare up.
So it's definitely worth a try. I think, there is something that shows us combination therapy is highly effective, right? If you're doing grounding and you've tried the neck work and things are really, really bad, you might want to think about a medication as being a supportive way to get through this part of your journey and then build some strength before sort of weaning off the medication and then doing what you can in the program. There is a time and place for medication, but that's up to you and your healthcare provider.
Yeah, you're talking, Melinda, about
And the antidepressant. Yeah.
Antidepressant,
Or
anti-anxiety.
pain medicine, right? Sometimes gabapentin is prescribed, or other types of pain and mood related medications.
Yeah. So from like just a pain medication perspective, um, the downside of a lot of the pain medications is that it actually kind of can make you more sensitive to pain, because you're kind of numbing the pain for a period of time, but then as you try to get off of it, it can cause like rebounds. Like for example, Tylenol, you can get rebound headaches. Advil tends to kind of disrupt your gut, which increases inflammation. Advil is an anti-inflammatory, but yet when you take it for a while, it disrupts your gut, which actually makes it, when you're not taking it, pro-inflammatory. So there are kind of drawbacks to a lot of, the pharmaceuticals. Um, and the evidence on them, specifically for healing concussion, is not great, but they can be a supportive tool in cases where you're having like a lot of extreme stuff, where sometimes just to like break that up and be allowed to or able to function can be a helpful kind of tool to put in place. Um, for example, like if your anxiety is through the roof and that's what's causing a lot of dysregulation, maybe an anti-anxiety might help, just to be able to kind of reduce that, right? Because what's and this is just another question. What is your kind of mindset around this? Like, do you feel that something's really, really wrong? Like, is that kind of what's going on?
I'm starting to wonder if there's something wrong with me, like like maybe I've pushed my symptoms so many times past their threshold that it's done some damage.
Like, what kind of damage? What would it do?
I don't know, maybe vascular. I don't, because I feel like when I push my symptoms, like today, I feel all this, like I hear popping in my sinuses, and I feel all this throbbing, and I have to go lay down because it just feels like it's mounting the pressure and stuff. And the pain in my eyes is really bad too, because I've been looking and using them more. So that's what I don't know. Did I do some damage? But I just feel sucked into this, like there's no way out of it.
Yeah.
And I don't really know. I don't know if I'm going to get better at this point. That's what I'm worried about.
Well, I think you will, but you're gonna have to, make some changes, and kind of do some things in order for that to happen. Now, what we know about concussion is that it doesn't cause damage at all, right? There's no damage in a concussion, right? You can't see it on any imaging at all, right? Or severe forms of brain injury, yeah, you can see it on imaging, but in a mild traumatic brain injury, which is a concussion injury, there's no visible damage at all to the brain. So it's a temporary dysfunction, and it only lasts a couple of weeks. The symptoms that persist are due to the other things, like the dysregulation in the system, like the anxiety that comes with it. That can manifest all sorts of symptoms, right? Even like, gut dysfunction. And if you already have kind of autoimmune issues, there could be some gut issues that you've had for a long time. Concussion injury will make those worse, because concussion through the gut brain axis, which is also mediated by the parasympathetic nervous system, you need to have good parasympathetic function in order for your gut to work properly, in order to digest things properly, to reduce inflammation and reduce the risk of like autoimmune type conditions. When your body is operating in a sympathetic state, which is fight or flight, your digestion stops working. You start getting, sick. You start getting aversions to foods and medications and sensitivities that weren't there in the past. But a lot of that can actually be related to this just imbalance. And you may have already had an imbalance, and concussion will just make it worse and set it off. So the symptoms you're experiencing, and this happens a lot of times, people think something is really wrong. But then you go to the doctor and they check various things and there's nothing there. And so they tell you, hey, look, there's nothing wrong. And you go, F you, there's something wrong. And then you start to think, well, it's something, the doctor's just missed something or whatever. And you keep kind of going in this circle of looking for what's wrong, when it's really just these systems that you can't easily diagnose, right? So persistent concussion symptoms are due to 5 things, right? 1, is your kind of anxiety mental health state, because that can keep symptoms around. The more you worry about something being wrong, the more dysregulated you are becoming. And then the worse things get, and then the more you start to think, see, something is wrong. And now you're like, woo, you're way out of balance here. And that's going to make things worse, and that's going to make you feel like something's wrong, and that's just the cycle just continues. So you need to do something to break the cycle, which is why I'm kind of going in this direction of just like trying to just educate so we can kind of calm down your thinking around it, that like it's not a sign that something's really wrong. Right now your systems are out of whack, but it's like, what can we do to kind of bring things back into balance, right? You're taking a very like avoidant style to this, right? I'm going to close my eyes, I'm going to sit in darkness, I'm not going to do any activity, I'm at my max, I'm going to go hide. That's an avoidant coping strategy, and that will just keep things, it increases anxiety, which then increases the sympathetic, overdrive, which makes you feel not safe, which then makes things worse. And so it's this kind of cycle. And where can we put a break in the cycle? And I think what Melinda's given you is a way to put a break in the cycle, to say, let's try to introduce some parasympathetic activity. The parasympathetic system is your rest and digest system. It's your calm, and it's activated by the diaphragm. That's why box breathing, because you're working your diaphragm. As your diaphragm works, it starts to increase parasympathetic. And when parasympathetic increases, sympathetic comes down. So the fight or flight comes down. This is why exercise is good, because you're activating your diaphragm. You're increasing your heart rate and your blood flow to put balance into the system. So, but the more we lie in bed, like for example, here's another study. If you take healthy people, no concussion injury whatsoever, and you tell them to lie in bed for 24 to 48 hours, you will dysregulate their autonomic nervous system. A healthy person lying in bed for 24 to 48 hours of bed rest will dysregulate their autonomic nervous system. It will put them into a state of autonomic dysregulation. And this is what we tell concussion patients to do, right? We don't, because we know better, because the research shows that it makes them worse. But most doctors will say, oh, concussion, dark room, lie down, bed rest, don't work, don't do anything. What is that going to do? That's going to cause disability. It's going to dysregulate your nervous system, because concussion already dysregulates your nervous system. And then you take somebody that has a dysregulated nervous system because of a concussion injury, you tell them to lie in bed. Guess what? Now we've actually made that person disabled, because that's just going to continue to get worse, because most of the medical profession is prescribing avoidant coping strategies. Oh, you have light sensitivity? Wear sunglasses. Oh, it's too loud? Put earplugs in.
Yeah.
And now your system gets actually more sensitive, because then the line for the threshold of what you can tolerate becomes closer and closer to zero. Right?
They've been having me go into, every time my symptoms flare, go into a darker room. And how do you get your symptoms to come down without doing that?
You learn to kind of deal with like what Melinda's saying, because when those symptoms start to flare up, that's your body just panicking. It's not something wrong. It's your body going into fight or flight. Why does your body go into fight or flight? Well, it does this when a bear is chasing us and we need to get away, right? We need to increase our heart rate. We don't care about digestion right now. We're into fight or flight. It's fight or flight. And when you start to have these symptoms increasing, that's just a sign that your body and your mental health, you're starting to think, okay, oh no, it's coming on now. It's starting to get worse. I need to go hide, right?
Yeah.
Well, instead, what you need to do is you need to say, okay, it's coming on. I know that I'm safe in this moment. I know that this doesn't mean that things are worse. And I'm going to sit here and I'm going to breathe my way out of this. And I'm going to sit with the discomfort of it. Because then what happens is, over time, you actually increase your tolerance, where right now you may be only able to tolerate 5 minutes. But if you sit in that and deal with that discomfort and just breathe your way through it and try not to panic and tell yourself that you're actually safe, that nothing is wrong, that experiencing these symptoms will not make me worse. It can't. There's nothing wrong with my brain. It's just dysregulation of my system. So I'm going to sit here and I'm going to try and bring my system into regulation.
Is that true even with the symptoms that are it feels like my veins are flaring and my face is getting pressure and my nose? Is that the same, those symptoms too?
Yeah.
I can continue?
Some people will start to feel tingling all over the body,
Yeah.
right? This is a sympathetic response. This is an anxiety. This is almost like you're having a panic attack. It's the same type of thing. People having a panic attack will think I'm having a heart attack. Oh, I can't breathe. Like, you'll manifest the kind of things that you're more kind of afraid of, right? So if you can sit there and try to work your way through it, your tolerance of 5 minutes will grow. And all of a sudden now it's 10 minutes at a time. And then it's 15 minutes at a time. And then it's half an hour before this stuff starts coming on. Right? But building the skill to be able to deal and sit in that discomfort will be a superpower for you. Because then even when you get up to an hour, 2 hours, 3 hours, this is still going to happen at some point. And being able to sit there and be like, right? And just calm it down, be able to deal with discomfort, tell yourself that you're safe, and just bring yourself into a parasympathetic state. It's almost like you'll reset and be able to, continue on with a little bit more time. Melinda, I saw you unmute there. Do you have anything to add?
I think you're covering it. It's kind of thought I have. I think you're describing it well. It's just what happens when we get more and more dysregulated, right? All of our systems go out of balance. And it's just saying, it's not that something's wrong and something's dangerous. It's that we're so heightened in our nervous system. There's also the opposite reaction that can happen, right? Where people can just shut down and freeze and go into like a collapse mode where they need to lie down or they feel they can't say anything. I did hear you say that as well. It's just a sign of, more nervous system dysregulation. And just like Cam said, remind yourself that you're safe, right? This is all in the course as well, right? So you can go right to the mindfulness section, like I said. For now, listen to those modules. It'll give you some good mantras. It'll give you some good grounding practices. And just stay there for a while, right? Until things stabilize. And then you can worry about all the other stuff. But to Dr. Cam's point, I think maybe trying some network and communicating your sensitivities to that provider would also be helpful.
Okay. I have one more question. I'm sorry. The sleep is definitely a problem. The whole not being able to go out and leave the house and being trapped in like all the time, is getting to me, and it's feeding the anxiety.
Yeah.
The sleep, I'll go a couple days, like a day or two with no sleep, and then maybe I'll get like 5 hours, and then I'll go again. I've been struggling with this. Does the lack of sleep, because sometimes when that happens, I lose sensation. Like I don't feel my pain anymore. All of a sudden, if someone massages me, I don't feel it. And then when I sleep again, it'll come back again. But 10 years ago, I had a concussion where it didn't come back for many months after I was starting to improve. So I didn't know, is that doing damage, me not sleeping? Because I know all the doctors are stressing to me, you have to sleep, you have to sleep. And I'm like, I know. And me wanting to sleep is making it harder to sleep.
Yeah. So there's a few things. Sleep is, if you don't sleep, your autonomic nervous system will dysregulate. And also, if your autonomic nervous system is dysregulated, you can't sleep, right? Do you think you'd be able to fall asleep if a bear was chasing you? No. Your body is in fight or flight, right? It needs to be in rest and digest. So the strategies that Melinda's giving you, right? Like the breathing, it's like you need to start working on that stuff before bed to try and bring yourself into a calm state. And if your mind is spinning, like, what if I don't sleep? I need to sleep. Why can't I need to sleep? That is just, that is not going to allow you to sleep. So you can try to find things that can calm things down a little bit. Like it's tough because yeah, go ahead.
Live I did last week is also one to listen to. That's lots of basic grounding that signals safety to the nervous system.
Okay.
I know we're way over time, so start there and then come back and see us in a couple weeks and let us know how you're progressing. There's also, of course, other things that you can do for sleep, but if we're in that really heightened state of dysregulation, it's going to impact your sleep as well. So I think first building that safety foundation, right? This is our Concussion Fix pyramid. And seeing how you do, reminding yourself that you're safe, right? See if you could tolerate nourishing foods, hot tea, eliminate caffeine, promote a restful state, right? Even if I'm symptomatic, is there something that can make me feel comfortable? You said somebody massages you, maybe touch feels really soothing. You said you stop feeling. That's also just a sign of nervous system dysregulation on the lower end, which we call hypoarousal, and it means we just shut down and go numb. And that's also a possible reaction to nervous system dysregulation.
Okay. Am I able to go outside now, like with my eyes in such pain with all
100%.
this?
100%. I
Okay.
want you to try. I want you to start, because
Okay.
just being inside is going to make you go stir crazy, which is going to increase your anxiety, which is going to make things just worse. So, yeah, get outside, take your shoes off, put your feet in the grass, even just lie down in the grass and just chill for a second and just breathe fresh air. But I want you to start going out without sunglasses, right? I don't want you to hide. I want you to go out and it's going to seem bright. Why? Because you've been inside for weeks.
The
So
pain is so bad. Okay.
it won't hurt you.
I would
Okay.
practice the nervous system regulation first before you try it.
Okay.
Yes.
You want your body to feel safe before you start eliminating things that are helping.
Yes. Now I do want to point one thing out. Before you started speaking, your husband was speaking for you, and you've been speaking the entire time. And you also said, I'm at my limit, and we've been going for how long?
I know, I'm a little afraid of the repercussions because my
No.
face hurts so
See?
bad.
Don't like, you're starting to get fearful of it, which is then just going to, right? It's the response to it. It's not the item itself. It's the fear of what might happen in the future that starts to make you spiral, and that starts to bring it on, because that's what increases the sensitivity to everything. So
Mm.
I think this is good that you were able to sit and do this, even though it seemed like you wouldn't be able to. You were already kind of saying at the start, I'm at my limit, but here you are.
My ears are ringing, and yeah,
It's fine though. But
you
you're
said before about the crashing, and it can make you worse. Or is that the crashing? Is that what you mean? Like when you push your symptoms too far?
Yeah. So I don't want you to go and, go for a run,
Okay.
right? It's pushing the limit without, over exceeding things, right? So it's right now, if your tolerance is 5 minutes, I don't want you to, stay in your room and avoid that. I want you to go in and try to get to 5 minutes and then breathe through it, right? So for example, like if we do the treadmill test on somebody, we're not supposed to do the treadmill test if somebody's overall symptom score is a 7 out of 10. We're just not supposed to do it. That's like a contraindication to doing the test. But at some point, if somebody comes in every day and they're like, I'm at a 7, I'm at a 7, I'm at a 7, I'm at a 7, we have to go forward, right? And so because your tolerance is so low, like one of the guys we were saying this is like, he was working 8-hour days, but he felt that his more kind of threshold would be 6 hours. So we pulled him back a little bit, right? With you, it's like your tolerance level is so low that we got to kind of push you. So it's just a different strategy for where you're at.
Thank you so much, you guys. You're very helpful.
You are welcome. You will get through this, okay?
Thank you.
I promise you will get through this. It's just going to be a bit of a challenge, right? It's going to be painful at the start, but then you're going to realize that, hey, I'm able to do 10 minutes now. Hey, I'm able to do 15 minutes. I'm, and you gradually get to the point where you'll be better.
Okay. Thank you.
Yeah.
Thank you very much.
Okay. That was a long one, but I felt that it was necessary. Okay. Next up.
Hey, what's up, Cam? Just checking in. I got the psychology stuff good it just works with me. It's very good. Oh my God. And so that's good. Now my next step, is working with Paul, just a one-on-one with him to get my HP access, my TRT, and then the growth hormone. So I'll get that taken care of. And then what I think it's the neck. I have a lot of pain in the neck. It's gotten worse. I feel like when I was doing the program, I just stayed inside and my neck got worse. And So I met a guy in my complex. He had a whiplash injury, and he searched 20 doctors. He went to the neuros, the chiros. He tried everything, and he was bedridden for 4 years. And he found this specialist. We live in Florida. That's 4 hours south, and he's like a upper cervical chiro, but he's a little higher up. He does different stuff. He worked with an MD that specialized in prolotherapy, neck instability, and his thing is severe neuro neck cases. And so I sent my stuff over, and this guy is like, you're whatever. I believe him when he tells me my symptoms, and so I'm going down there in 2 weeks.
What's his name?
And his name is Brian Hutchinson.
Okay, I don't know.
He's a chiro, and he worked with the MD is Hauser out of Fort Myers, and they do everything. Not just, maybe 1 or 2 videos on TBI, but the rest is different, just neck issues. So I don't know if it'll work, but
hey, it's worth a shot. It's worth a shot. You know, a lot of these, I've kind of changed my tune a little bit on the upper cervical guys. I used to be kind of more like anti, but like I've been chatting with a number of them, and some of the stuff they do kind of seems like it does make a lot of sense, and so I think it's worth a shot. You know, give it a go and see what happens. There's another guy too. Where in Florida are you?
I'm in Orlando.
Orlando. So there's a guy in Orlando. I think he's in Orlando. Where is he? Actually, he might.
Hook me up.
He might be in Palm Beach. Let me just see here.
Yeah, this specialist is in Fort Myers, which is a 4-hour drive. And you know how I was 4 weeks ago. I couldn't do anything. It was awful. And I saw a chiro, and I did the H-spot just to get out of the house. And I go 6 days a week the last 5 weeks. I've been real consistent. I don't push. I got the psychology good. And now I can kind of take a breath and make more better
Palm
decisions.
Beach.
Yeah,
How far are you from?
Beach.
How far are you from Palm Beach?
Palm Beach, I don't know. It's probably like 5 hours.
Oh, it's farther, eh? Okay, never mind.
Yeah.
I thought he was in
What
Orlando.
does he do? Is he upper cervical?
He's an upper cervical guy, but he actually is like he does a lot of like autonomic stuff. Like
Okay.
he's really good. So I would say if this guy comes recommended, the one you're going to in Fort Myers,
Highly, like people fly from Europe, but it's
yeah,
not specific for TBI. That's why.
that's okay though. It doesn't matter, right? People get hung up on that idea, right? Like if you think about what you're dealing with in concussion or post-concussion issues, it's like it's the 5 systems. Right? You don't need somebody who's like a concussion specialist necessarily when you're dealing with one of them, which you think is neck. You're just dealing with it. You want a really good neck specialist. That's it. Right? So don't get hung up on the TBI thing, but it's you had a concussion, but you also had a neck injury. Right? And so now you're just dealing with that component of it. Now, if you find that you're going to this particular individual and you're not seeing the results you want, it could be because the upper cervical guys only deal in the upper cervical. And a lot of times it's like muscular dysfunction and like postural stuff, and it can be further down chain. So sometimes it's not helpful for certain cases, but in some it is. So it's worth a shot.
His thing is I go down there for 2 days. If it works, I stay additional 2 days, so I get 4 days in. He does the digital motion x-ray, so he sees you in motion.
Yep.
Then he does the ultrasound to look at your jugular vein compression. And then he does this new thing, tendon dry needling. I know with this program, it's not about all that. I'm just explaining as if this was a one-on-one.
Yeah.
And he does weights. So you do those 1 minute twice a day, and those 2 things correct your curve with the goal of postural, so
Yeah.
your
So
symptoms.
yeah,
Yeah.
so it sounds like he's got a lot of tools in his repertoire, right? So I think it's yeah, I mean, I would do it if I were you.
Cool, man. Well, I
Yeah.
appreciate it.
Good luck. Keep me posted.
Yeah. Yeah. Thank you, Cam. Thank you,
Cheers.
Linda. Thank
Cheers.
you. Bye.
Okay, last up is
So I think it was, but kind of similar, but much further along. A lot of sun sensitivity, a lot of heat sensitivity. It seems like my body's not regulating the heat. Benadryl's been helping, but I don't really want to be on Benadryl a long time. So it seems like it's some sort of like central nervous system, automatic nervous system, and trying to figure out like what are kind of the next things to try to get that back to where it's supposed to be, so that my body like not always sweating when it really should be sweating. Things like that.
do you get you said Benadryl. Do you get like hives and like tingling and itchiness in the heat?
That's not why I was taking Benadryl. It's because so I have a lot of severe reactions, so Benadryl is a common thing. But I had taken it for a reaction and realized that it made my like driving home for 10 minutes in the afternoon in the sun would make my headaches go through the roof. And that's like it's in the car with sunglasses, but it's a little bit warm. And happened to have taken Benadryl for a different reason, and it wasn't as bad, so tried it out. Realized that as long as I'm taking Benadryl, with it becoming summer, I had to increase the amount of Benadryl I'm taking. So like I can get through I can get through the day much more easily. So still using polarized sunglasses and blue light filtering glasses for the most part. But I can get through the day between those and Benadryl. The problem is that if you take Benadryl every day for years, it's not good for your body. So trying to figure out how to like get the central nervous system or automatic nervous system back, and wondering if we have some tips, because now we're in summer and now everything is worse.
Yeah, I know Dr. Herkel is always good at answering these histamine questions. Usually, if you're taking Benadryl, it means you have a histamine imbalance or high histamine in the body. There's great diets for high histamine that can help you be less reliant on Benadryl. The other thing is, of course, this is not my area. This is me reiterating what Dr. Herkel would be saying, is that there are better antihistamines out there that aren't. Benadryl has something in it that's not supposed to be good long term, but there are other ones that don't have the same kind of negative effects. Again, not my area of expertise, but could be something to look into. But maybe that's a great question for Dr. Herkel. You could send him a direct message on the platform and just say, hey, I have a histamine intolerance or histamine issue. I'm reliant on Benadryl. What should I do?
Okay, I actually posted it this morning, but I can do that.
Oh, great.
Just tag him in it so that he sees it. If you posted it. Yeah, I mean, I'll give you like a personal story of mine. Is that I started developing like hives when I exercised, right? I've had like asthma my whole life, just exercise induced asthma, and I've always had to take inhalers for it. And then I started getting like my skin would break out in hives, and if it was really hot, I would get like heat, like urticaria, where I'd actually kind of get like blotchy and stuff, and I wasn't sweating well and whatever. And I mentioned it to like my doctor. My doctor sends me to an allergist. The allergist says like, oh, you have exercise-induced anaphylaxis. Like you need to carry an EpiPen when you work out, and then just take a Reactin every day before you exercise. So I started doing that, and I did that for like a year. And all of a sudden, after a year or so, the Reactin wasn't even working. Then I go back, and they're like, well, now you have to take 2. And I was like, well, when does this stop? Right. And then I mentioned this offhandedly to Dr. Herkel at one of our advisory meetings for complete concussions. And he's like, dude, that's all gut. He's like, that's all gut. And so I went and I saw him, and he basically changed my diet and did like some food sensitivity testing on me and stuff, and found that certain foods were kind of, not good for me. And so I changed my diet, cut that stuff out. And within about a week, I was like, oh my God, like mental clarity I could think, I had energy, and now I could go and I can run now. I can run without needing my inhaler. Something I've needed my entire life. I can run without ever having to need my inhaler. I can do exercise. I don't get blotchy or hives when I work out anymore at all. I don't take Reactin at all. Even my seasonal allergies have come down. And so all of that is just because I had a lot of like gut issues, and I fix it through gut. So you're thinking it might be autonomic. I'm thinking that, like Melinda said, I think this is a question for Dr. Herkel, because I think it's probably a lot of like gut issues, which is probably where the other reasons you need Benadryl are probably coming from the same kind of thing, right? Because if you have gut dysbiosis, you can have these elevated histamine levels, and certain foods will promote that, and other foods will kind of be more anti that. And there's some supplements you can take as well that are basically natural kind of histamine blockers. They just reduce your histamine production.
Okay.
And they're a lot better for you than just relying on a medication to do it. So yeah, I think too bad Dr. Herkel's not here, because he would be able to just knock this one out of the park. But if you message him at least, and just make sure you tag him in the post that you made so he sees it properly, I think he'll be your best bet.
Okay, I'll give that a try.
Okay.
I agree.
Yeah, appreciate it.
All right, I think that's a good spot to wrap it up for today. Thank you for all the questions. A lot of really, really great questions. Went really deep into some, which is fantastic. We had so many comments, very appreciative of the information shared. So we always appreciate that as well. Otherwise, I hope everyone has a fantastic day. Bye.
Bye-bye.
Bye, everybody. Have a great day.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.